refresher here on what exactly hepatitis A is. Maybe most alarming is who is also getting this viral infection. Typically, cases have been reported in those experiencing homelessness in the past who don't often have access to toilets or hand washing, but now the health department is seeing cases reported in those who aren't homeless here in Los Angeles.
Treatment options. Current treatments, doctor had used pegalatin, diphtheria, IFN for a while to tackle HDV, but it doesn't always work well. Patients deal with relapse after treatment and side effects can be rough. Effective management of chronic infection, which HDV is essential to reduce the risk of severe liver disease and improve long-term health outcomes. So, and especially for the children out there, adults should be looking into it and get familiar with it because there is an outbreak right here and it's getting very bad. Hepatitis D, also called HD infection, is widely known as the toughest form of viral hepatitis. Although not as famous as some other liver disease, its impact can be devastating for those who get infected. Here are some of the symptoms of hepatitis A. If you want to look at things, fever, weakness, stomach pain, dark urine, vomiting, and jaundice, Jaundice. You see, and yellow eye. Recovery in this case can lead to liver damage and even death. So be very careful out there. You know, and in the past year so far now, back here live, you know, we've seen that public officials are saying that there's a vaccine and that comes back and it could basically help you get rid of that hepatitis B symptoms. Nearly about 30 to 40, maybe even 50 cases per year of hepatitis B will be reported. You know, last year they're reporting 165 cases and more, on track to see those higher numbers this year, already reporting 29 cases. So far promoting public health officials to announce this community-wide outbreak, want to get into some details because they need to start implementing hepatitis B vaccines. Hepatitis A is a serious disease of the liver that can cause death. It is caused by the hepatitis A virus, and it's spread most often through infected food or water. Hepatitis A may also be spread by close person-to-person contact with infected persons. Although some infected persons do not appear to be sick, they are able to spread the virus to others. We see that hepatitis B is usually, there's a lot of myth out there, you know, like myth number one. So we want to clear this out and make sure that we get everything right so that when we go out there, we're not easily deceived or living in fear. Because hepatitis B, you know, one of the myths is that hepatitis B can be transmitted through casual contact such as kissing, hugging, handshaking, or sharing of meals and utensils with someone who has the disease. And as we look at that, we try to distinguish and find out if that's true, because that bothers a lot of people. And it comes to be that that's false. It can only be transmitted through unprotected sexual contact, blood-to-blood contact, such as exposure, blood to blood. That means your blood and their blood, you see. And whatever. I don't know how that could happen, but one of the examples is contaminated equipment while doing tattooing or at the barber shop or at the tattoo shop, sharing of needles or syringes. This can affect you. Among intravenous drugs, abusers, of it can affect the mother to her child at birth, but not as you think, but through, the birth, that disease being transmitted. Another big myth is mosquito bites. You see, mosquito bites cannot be transmitted. It cannot be transmitted by mosquitoes. So some example of mosquito-transmitted infection include dengue, dengue, and malaria, but not hepatitis B. And myth number 3 is that hepatitis B is genetically and hereditary. It can be passed from parents to child. Well, let's look at that. That truth is false. It is not genetic and cannot be inherited. It is an infectious disease. It can, however, be passed and infected mother to child during the birth process due to contact with bloody fluids. Like, for example, like we get the syringe or the equipment being used can transmit the disease. So we have to be careful in the hospital when we're working with that. And then myth number 4 is that all patients with hepatitis B infection will have symptoms such as jaundice, Jaundice, which is the yellowing of the eye or skin. You see, we have to be careful because most of these tactics are used to get us in the hospital to take the vaccine even when we don't need it. So clarifying all of this and knowing that, that is false is one of the many, and just knowing that is just a sign of liver problems, you see. But not all hepatitis B infection cause liver problems right away. It does take time before you would know. So a lot of hepatitis B patients usually do not have noticeable signs and symptoms. And they may only experience symptoms when they have more advanced disease, when it gets worse. And the liver cannot function normally. The only sure way to find out is by getting a hepatitis B blood test. And with that, you could find out, instead of living in fear, if you have hepatitis B. And it's only an acute, and if you don't like taking vaccines, you could say no and find ways to take care of it naturally.